From a Chinese medicine perspective, the way we see trauma is anything from our past experiences that affect us today. So it's anything that keeps us from living in the present moment.
Katherine Rohland is a holistic healer, acupuncturist, and founder of Manhattan Medicine Women.
She uses Chinese medicine and shamanic healing to help people heal from trauma and restore well-being.
So we store this trauma in our joints, and we can store it our entire lifetime, and we can pass it on to our next lifetime. That's an option. The other option is that we do the work. We get stronger, we build resources mentally and physically, and we release that trauma from the body.
How can individuals begin to release those emotional blockages from their bodies? What are some physical or emotional signs that someone could watch out for? Maybe they don't know it's trauma related.
The one thing I want everyone in the world to know is whatever you're going through mentally, physically, or emotionally, it is reversible. And I think so many times we're told it's not, that we're told there's no hope, there's no way, there's no cure, but there is.
Today I'm joined by Katherine Rohland, a holistic healer and the founder of the Manhattan Medicine Woman. With her extensive background in Chinese medicine and shamanic healing, Katherine helps individuals address trauma and restore their well-being. In this episode, we'll explore how trauma affects the brain and body through the lens of Chinese medicine. Katherine, I'm wondering if you could explain to me, in your point of view, how trauma, and more specifically emotional trauma, impacts the brain and the body according to Chinese medicine.
There's a few ways to explain it, but to start, let me just explain what I'm talking about when I'm talking about trauma, because I think everyone has their own definition. But from a Chinese medicine perspective, the way we see trauma is anything from our past experiences that affect us today, right? So it's anything that keeps us from living in the present moment. So anything in the past that felt like it was too much or too little that affects how we act and how we perceive the world and how we show up in the world today. And that includes anything from the past that also affects our future, right? How we feel about moving forward. Maybe it creates fear or anxiety or worry about moving forward in the future. It's also any time or any moment in life when our emotions were too much. Trauma can be anything, right? It can be physical, it can be emotional, it can be small experiences that we experience in high school, it can be parents yelling, it can be a lot of things, but what makes trauma is how we feel it. So it's anytime those emotions are too much for us to handle, or we receive too little in return, meaning we didn't get enough support, we didn't feel like we were seen, didn't feel like we were allowed to be heard. So that's how we define trauma. And so in Chinese medicine, trauma sits at our yuan level. We have different levels of energy, of qi in our body. And the yuan level is the deepest qi, the deepest energy that sits in our body. It holds our DNA. It holds where cellular change can be made. It holds our motivation, our purpose, and who we're meant to be in life, right? So when we experience trauma, it gets imprinted at that yuan level in channels that we call the 8 extraordinary channels in Chinese medicine. And those are the first channels that develop in us, and they start to develop in utero, and then will start to emerge as we age and as we get older. And that's because these channels, they hold our blueprint for life. They hold who we're meant to be, what our purpose is. And then it also imprints past experiences and our way, how we're experiencing them today. And it also deals with how we show up in the future. The channels also imprint how we feel about ourselves and how we feel about the world around us. So when we undergo any trauma, it throws off these channels, these 8 extraordinary channels, out of balance. Now, the irony or funny thing about these channels is they all enter our brain, right? So if I showed you a picture, you'd see all of these channels. They emerge from somewhere in our kidneys. Or on our kidney channels. And in Chinese medicine, when we're talking about the energy of our kidneys, we don't mean the actual physical organ, but the energy of our kidneys sits below in our pelvis. So anything below your belly button, that area, which for women will include your uterus, for men, your prostate, that's the energy of our kidneys. And so these channels, they all cross over that energy, and some emerge from that energy. And then they all end either at the middle of our eye, right here, the corner of your eye, which gives you the ability to see yourself and see the world and see how we perceive the world around us. And from there, it also enters our brain to control how we think, right? Other channels, they'll end at the apex of the head or the back of the neck, but all enter our brain and the way we perceive and think of the world. Now, in Chinese medicine, the mind and the body are never separate, right? That we always see them as one, which is one of the main things that has drew me to Chinese medicine and keeps me excited about it. Because often in Western medicine, we have these arguments and discussions about certain elements, whether it's chronic fatigue or fibromyalgia, or even sometimes IBS, whether it's coming from your mind or your physical symptoms, it's coming from your body. And the truth is, at the end of the day, it doesn't matter because it's all one being.
I love that. And everything you've said is so in alignment to what I always preach on this podcast. One, trauma is never the event.
Right.
Trauma is the interpretation of the event. Right. And how that interpretation of that experience continues to live in your mind, body, and psyche and hinders you, self-limits you. I also always say that because my specialty is complex PTSD or developmental trauma, that the experiences that we have before the age of, say, 9, 10, 11, 12 impact the way that you view yourself, others in the world around you. And if that impact is self-limiting and negative, that's the trauma, right? And so it hinders your ability to see the future through anything other than a filtered lens. And I say you're filtering it through your unhealed wounds, right? And you tapped into that. Not feeling seen, not feeling heard, feeling insignificant, not enough. I have so many things I can talk to you about in this respect because I personally have been diagnosed with a lot of autoimmune conditions. And I also have a significant trauma history, right? So given my knowledge, obviously, I've taken a very holistic approach to my healing, which I definitely want to dive into. But one thing, I have two things I want to do. Number one, maybe just define a little bit further for the listener what Chinese medicine is and where acupuncture fits into Chinese medicine. And then also the second part of that is what inspired you to pursue a career in that.
Sure. So Chinese medicine incorporates a whole holistic healing modalities, right? So it's more than just acupuncture and energy work, although I personally would argue that's the most important aspect. But Chinese medicine includes diet. So Eastern medicine is a big part of my practice, and Eastern medicine differs from Western medicine because we're not just focusing on macros, right? How many carbs, protein, starches we're getting in our diet, but it's the energy of the food we eat. And in Chinese medicine, every food we eat has a specific energy of it that attaches to a specific organ. Foods can be hot in nature, they can be cold in nature. And it's not just what you're eating, but also how you're cooking and how you're enjoying your food that goes into it. So diet is a huge part of Chinese medicine. Lifestyle is a really big part because we always need to be balancing our yin and yang energy. And so for those that aren't familiar with yin and yang energy, to put it simply, yin is nighttime, it's rest, it's dark, it's cooling, it's that restorative energy. And yang is everything else. So yang is daytime, it's work, it's energy, it's exercising, it's going out with friends, it's sunlight. And we need a balance of those two. And most people in modern day life do not have a balance. They have a depletion of yin and an excess of yang, which yang is never really in excess. It's just that we don't have enough yin to hold it down. Because just like nature, our bodies are always a balance of yin and yang. And when one is off, the other is off. We see this in nature because you have winter and summer, right? You have fall and spring. You have the leaves falling and then the plants growing in spring.
Yeah. I love that. And what I was writing down, two things. Number one, when you talk about the energy of food. So my children are Korean. They're adopted from Korea. And I have quite a few Korean friends. And when my kids were really young, one of them lived across the street from me and she would take me to H Mart. So H Mart here in New Jersey is a very large Asian food chain.
Yeah, we have them in New York City also.
Yeah. What I was so fascinated with when I would go to H Mart is that you would go into the produce section. And first of all, they had different produce than you would find in an American food store. They had a lot of similar things, but then they also had some things that were unique more to the Asian culture. However, what I'll say is what always fascinated me is that, to your point, the food has purpose versus here, like in the States, we just consume to consume for the most part, not everyone, but there the food is purposeful. So they'd have these chalkboards, these really colorful chalkboards above every produce item. And it would tell you why you're eating it. What's the benefit of the melon? What's the benefit of the apple or the Korean pear, whatever the food is, a berry? It would tell you what body part it's good for and what it can create inside your body, right? What I always thought was so fascinating. When you were talking about the yin and the yang, which I think a lot of people here in the States say yin and yang, right?
Right.
When you were talking about that, before you even got to the point of talking about the imbalance, I was writing down people fight the yin. I find so often with my own clients as a trauma practitioner that there's a fight against rest. Mm-hmm. Many of us were raised with this mantra of, if you're resting, you're lazy. And I see this with a lot of my clients who are burning out and who have resentment towards their partners that can rest. And they see that as lazy, and they get frustrated because they actually have physical anxiety if they try to rest, because they were programmed and indoctrinated to believe that rest is not restorative, rest is lazy. And I always try to tell them that I have nothing to back this up, but I can only assume that the word rest comes from the word restoration. We need to restore our bodies. Our bodies need to be refueled. They need to be rested. The batteries need time to recharge. And I think for a variety of reasons, generational trauma being one of them, we were not raised in a culture to believe that it was okay to stop and breathe and rest. And so, as you were saying, that yin yang, that yin and the yang is so off balance for so many people. And then they're not feeling peace within their system.
Right. And trauma, just to speak to that specifically, is a yang response, right? Trauma puts us in fight, flight, or freeze, which is that yang energy, right? It's that heat rising that allows you to run away from a tiger if you need to. It allows you to respond to danger. And when we have trauma, often our nervous system, our yang, is activated with that trauma. And we are essentially leaking yang, whether we want to or not. And I work a lot with women's health. And what I'm working with a lot is building yin. Because building yin is a thick substance in our body, right? We can think of it in terms of esoterically, in terms of balance, but in terms of tangibility, it's thick substance in our body. It's that collagen. It's that material that supports the creation of our hormones. And when we deplete our yin, we don't have enough resources left for our body to be able to live healthily, right? To do what it's meant to do. Our bodies are self-healing things, but we have to allow them to, and we allow them to by building resources in our body.
Listen, as a trauma care practitioner, when I started doing this many years ago, for better or for worse, I think it was great that they did it. When we started school with this particular organization, we had to fill out our own self-care contract. And, the whole idea is in a healing, profession, you can burn out very easily because you're giving, and you're not really restoring. And so I always make a practice to do something to restore my body every single month. So I don't hold it in the fiber of my being, because I have had issues with autoimmune and those kinds of inflammatory conditions, which we'll get to. So my self-care of choice is acupuncture. And I have an acupuncturist that I love, and I basically book 6-8 sessions out at a time with her. So I have it built into my calendar. So I know I'm going to be taking care of myself. And when I go, I always fall asleep on the table. Like, my nervous system gets so relaxed. 2 times, I've been seeing her for years. Twice, I've almost felt like I was levitating out of my body, because I literally I surrendered to such an extent that I did not feel connected to my body in a good way.
Yeah.
Right. And every time that happens, or even this last time, I just went last week and I really chilled out on that table. I can hear in my head, you're widening your window. You're widening your capacity to hold space for other people and for myself, right? Because we all have our own stressors. And then I also love cupping. So I want to talk a little bit about that. I don't know if that's something that you incorporate, but I know why I do it for my body. For those who might not be realizing that they're carrying trauma, what are some physical or emotional signs that someone could watch out for that you see people coming in? Maybe they don't know it's trauma related.
Right. So chapter 1 of the Suen, and the Suen is one of the first recorded documents of Chinese medicine. It states that all illness starts in the mind, right? So one could say that if you're experiencing any symptom, it's a sign that you have some emotional trauma going on in your body, right? And there's different levels of trauma. Trauma can be current, right? And we could even not call it trauma at that point. We could call it emotions. Not everything has to be trauma. Or there's deep-rooted trauma. But more deep-rooted trauma, a lot of the times the way you're going to see it as the first symptom that most people will really notice and take point to is joint pain, right? So we hold trauma in our joints, and we're meant to hold trauma in our joints. Our joints are these cavities. And when I say joints, I also include like our spine. Our pelvis is a big basin that holds trauma. It's a kind of a big cavity. So it's these big cavities in our body where we have space to store things, where we hold trauma. And we're meant to do it. Our body holds things in latency on purpose so that when we experience things that we are not ready to handle or we cannot handle in that moment, our body can take it on without that getting to our internal organs and causing something fatal happening in our body, right?
Mm-hmm.
So we store this trauma in our joints, and we can store it our entire lifetime, and we can pass it on to our next lifetime. That's an option. The other option is that we do the work, we get stronger, we build resources mentally and physically, and we release that trauma from the body. And we can talk about that more. But going back to joint pain, as trauma holds over time, as we store trauma, it wears down our resources, right? So it causes it takes a lot of blood, it takes a lot of qi, a lot of energy, a lot of yin, a lot of yang to store that trauma in our joints. So as it starts to break down, whether it's just from storing that trauma, from having more trauma, from having excess emotions, or from a poor diet, right? Not really feeding yourself and nourishing your body well. As that starts to break down, it will break down our ability to hold things in our joints, and we'll start to feel joint pain. So that's usually one of the first symptoms people will feel.
You're speaking like so deeply to my soul right now, because during COVID, I don't know what the extra layer of, look, it was a pandemic, right? But there was some extra layer of trigger in my nervous system that early on, my joints, I don't even know how to describe the pain that was in my joints, but it was epically painful. Stopped finally, after probably 35 years, stopped me in my tracks. And it was a very, very specific kind of pain. It was deep inside the joint on the inside.
Right.
So inside of my elbows, insides of my knees, inside of my ankles, at my toes, inside my finger joints. My fingers were bruising from the inflammation.
Wow.
At my shoulder joints. And I knew something was very, very wrong. And combined with that joint pain, it's a very unique type of sensation. I also had extreme fatigue. And I would say to my husband, I'm not tired. Every cell in my body feels like it's shriveled up like a raisin. There's no energy in my cell at the cellular level.
Right.
This is not tired. This is fatigue. I don't know how else to describe it. And because COVID was happening, it was very difficult to get into doctors. But eventually, over like a 6-month period of time, I was diagnosed with what's known as seronegative rheumatoid arthritis. Mm-hmm. So when you're diagnosed seronegative, basically what they're saying is you present like you have rheumatoid arthritis and you have all these markers for inflammation, but you don't have the rheumatoid marker.
Right.
So my doctor was like, great, we'll prescribe you a steroid. And because I have always used not always, but for like the last 10, 15 years, I've really relied on acupuncture a lot. I just said, let's take a beat on that. I have some other things I want to do. I'll come back to you. And I was in severe pain. So taking the steroid would have been a very quick fix.
Right.
But I didn't want to not, in my mind, I knew that the joint pain and this diagnosis was the symptom of a deeper problem. And I didn't want to put a Band-Aid on a bullet wound.
Right.
So I got into my car, and part of my expertise in trauma is the ACE study.
Oh, yeah.
And ACE stands for Adverse Childhood Experiences. Anybody can search up that ACE study. It's done by the CDC in the 90s. So I immediately went to my phone and started Googling ACEs and rheumatoid arthritis. And based on my ACE score, there was going to be like an 80% chance that I was going to end up with some sort of chronic inflammatory, chronic pain diagnosis. So the gal that I work with in acupuncture here on the New Jersey side of the river, you're in New York, I knew that she was very trauma trained and trauma informed. So I went to her and we did this intensive 3-month, twice a week, every week. And this is the story. I will never forget this moment. The pain was so epic. I had micro tears in my shoulder from all the inflammation. And I insisted every single time I went that she did cupping on me, because intuitively and innately, I felt very strongly that whatever had yet to be released, and I'd been doing work on myself for 20 years, was deep in the fiber of my being. And to me, sucking that out of my fiber was like part of the treatment. And her cups are in the shape of hearts. So she covered my entire back from my neck to my butt. And that can be a very intense sensation when your whole back is covered like that. So it was very, very intense. And I remember thinking to myself, do not label this experience with these cups. Don't say this is painful. Don't say that this hurts. You can just tell yourself it's an intense sensation and just lean into it. And as I did that, I could relax into that sensation. Once I could surrender to the cups being on my back, I heard something in my ear. And what I heard was, you were never alone. I was always with you. And I burst into tears. And what that meant to me is exactly what you just said, which is your body's job as a protective layer is to take on the physical aspect. And my trauma was not any type of physical abuse. It was all emotional, psychological. But I realized in that moment 2 things. Number one, I had not yet uncovered within myself that part of my trauma was the fact that I felt so alone and isolated in my experience. So for me to hear you were never alone, I was always with you, cracked open an awareness that I needed in order to heal.
Yeah.
Number one, it was profound for me. Number two, I now understood what my assignment was, which was to give back to my body. Mm-hmm. And it shifted the entire aspect of the treatment. It kind of just flipped everything on its head. And my whole perspective of why I was doing the acupuncture changed even further, because it was now me giving a gift back to my body, right, not me trying to heal this diagnosis or whatever you want to call it, this inflammation. Yeah. I'm telling you, after that experience, I continued to do the acupuncture and the cupping. But when I say my body rapidly started going into remission, my level of pain diminished very quickly. My fatigue started to diminish very quickly, and I was starting to feel much more like myself. And I had to go back for extra testing. And remember, I'm bringing everything to the surface now. So I go back in after 3 months, they retest me. My numbers are now even worse than they were before, but I feel better. Mm-hmm. So I said to the rheumatologist, listen, my pain is better. My fatigue is almost gone. I know my numbers are now a 10 out of 3 versus an 8, which it was, but I feel better. I'm not looking to do anything. And she said, just keep doing what you're doing. We'll treat you, not the number. And I kept doing that treatment. And after 1 year, my number, I think the baseline for rheumatoid arthritis is around 3 for your C-reactive protein. That's this inflammation marker. And I was under a 2.7.
That's amazing.
It was amazing. But I share that because I want people to understand what it is that you do from a really practical application. I did it because intuitively I knew I wanted to try that first. I had no great hopes that I would actually put it into remission, but I really did put it into remission. And now if I get a flare up, it lasts not even a day because I'm very aware now of what that extra layer of emotional trauma was for me. And I can then do some more inner child work if I need to, and it dissipates.
Right. So I think awareness is a huge part of any treatment. And this, I feel like, is where my practice differs a lot from other people's, not everyone's, but in my framework that I put together because it worked for me and it works with my patients and that I now practice consistently, is we're first working to uncover what is going on, right? And I do this questioning not based on being a therapist, because I'm not a therapist, but based on the acupuncture channels and what I can read in your pulse, what I can tell from what you're telling me energetically, to unravel what is that core belief, right? What is that core belief that it was instilled to you earlier in life? And sometimes you might remember why, sometimes you might not. That doesn't matter as much as understanding what that core belief is. And then using that knowledge, that awareness, and the energy of the channels, we can rewind your physical and mental state.
I love it. So how can individuals begin to release those emotional blockages from their bodies using some of the techniques that you do? Can you get more specific?
Yeah, so the framework I use, it's 7 steps, but we start with investigation and uncover, right? So think about what symptom or what illness is going on in your body and when did that first start? And maybe there's a secondary symptom tied to it, right? So let's say your symptom is endometriosis, but you also have a lifelong chronic constipation or digestive orders. You want to always go back to that other symptom as well, because usually, not always, but usually something that's going on today started with something else, right? So either way, going back to the root of your symptoms or illness, something that feels like it matters to you and your body and your life, and asking yourself what was going on in that time, right? Start to investigate, where was I in my life? What was going on? And a lot of times people need support with this. Sometimes they can do it themselves, but how did I feel? I think it's really important to understand how you feel, because it's not always a big thing that happens. It's not always a breakup or a move or abuse or a change in scenery. Sometimes it can be how we felt. Maybe we felt scared. Maybe we felt very self-conscious at that period in our lives for whatever reason. So we're going to uncover what that is. And then step 2 is, what is the belief behind that? So you had a period of time where you were feeling off, but why were you feeling off? What was the belief that you were thinking? And this can be tricky sometimes, because sometimes that belief is subconscious, right? I have gone through a lot of healing around not feeling worthy and not feeling good enough. But for a big part of my life, that was not a conscious belief. I thought I was confident. I felt confident, but there was something subconsciously holding me down, and that actually was holding me back from moving forward in my life. A way to do this, to discover this, is journaling. I think is a really beautiful way, really writing how you felt at that period of time, and then coming up with what thoughts and beliefs were behind that.
Mm-hmm.
So once we have the thoughts and beliefs, we can go on to step 3 and rewrite them, right? So if your belief is I'm not worthy enough, or going back to what you're saying, like I have to always be doing, or I'm lazy and I'm not worthy, what's another way we could rewrite that? Rewrite that saying, right? So instead of resting as lazy, resting is the most productive thing I can do for myself. Or it can be as simple as, if you feel like you're not worthy, I am worthy. Understanding that you were born into this world as this perfect human, this perfect baby with endless possibilities, and that's who you truly are at your core and at your heart. And so once we rewrite the belief, one, we can start to repeat that to ourselves, and that's a mantra, right? Everyone can do a mantra. You can do a mantra anytime. You can do a mantra at home. But what I like to connect it with and take it deeper is energy work. So in my practice, I use the energetic channels of Chinese medicine, either remotely if I'm working online with a patient, or in person with the use of needles. I think it's important to understand in Chinese medicine, the energy of the channels, it's not the needles that are doing anything. It's the energy behind those needles and the intention behind those needles that is reshaping and rebalancing your energy, which is why we're able to do this work remotely. Acupuncture and Chinese medicine started out as a shamanic medicine, healing the channels without touch. And it's something we can still practice today. And it's insanely effective. I would almost say it's more effective than in-person treatments, but it's equal at the most. So you can use the energy of the channels. And that's honestly something anyone can do with the knowledge, right? That part would take understanding, studying acupuncture and Chinese medicine. And there's some great resources for this that I can go into later. But if you're not at that place yet, there's some other ways to do it. It's just feeling into your body, right? So if you just sit for a moment and close your eyes, take a couple deep breaths in through your nose, out through your mouth, maybe put one hand on your heart and one hand on your lower belly. And I like the hand placements for a specific reason, because our lower belly holds the energy of our kidneys, which holds our purpose, our blueprint of life, what we are meant to do in this world. And our heart holds our Shen, which is our spirit, our ability to shine, to bring joy. So it connects our purpose with our ability to lead out our purpose, to shine in this world. So first, just taking a moment to sit like that, taking a few breaths, and then just feel into your body. And after you do that, after you get a baseline of how you're feeling now, say to yourself what that negative thought is, right? Say to yourself, I'm not worthy. And notice how that feels in your body and where you energetically feel it. We don't need all the knowledge in the world to understand how we feel and where we feel it in our body, right? That's something anyone can do anytime on any day. So once you feel it in your body, you want to move that energy out. And I like to move that energy out with breath. I think breath is a really supportive way to do that, by taking deep breaths in through your nose and out through your mouth, sending your energy to that area, maybe visualizing it spreading or clearing. I think everyone has different things that work for them in terms of visualizing, but dispersing that energy in a way that feels good. And as you do that, start to repeat the rewired mantra. So if you're going with I'm not good enough, I am good enough. Right? And say that. And as you say that, feel that in your body. Feel that energy. Take on that energy of who you want to be. We attract the energy we put out there, right? So the more we practice living in the energy that we want, the more we will actually live in that energy.
Mm-hmm. That's awesome. I just was saying that to a current client earlier today. We were talking a little bit about energy work. And, you know, it's interesting as I listen to you talk, some of the work that you're doing from that energy channel, from that chi, is not too dissimilar than the work that I do with my clients when we're doing parts work.
Right.
And we're trying to figure out, you know, what part is present and what's its benevolent purpose in the person's system at the time.
Yeah, I love parts work. Yeah.
It's so good. So here's a little case study for you. So I've been diagnosed with 3 different autoimmune conditions in my lifetime. And I'm always very curious about that.
Sure.
Right? So the very first one started when I was like 15 or 16 years old. It didn't get formally I put in quotes diagnosed because I'm not like big on pathologizing anything, but let's call it what it is. So at 26, I was finally diagnosed with Raynaud's.
Mm-hmm.
And what really hit for me was what you were talking about earlier. And if people are not familiar with Raynaud's, and people call it Raynaud's, it's a circulatory issue. For me, as I've gotten older, I'm now almost 53. I've always had this condition, or I should say I've always struggled with this condition. But it was much more in alignment to if it was actually cold out. Now it doesn't have to be cold out, and I struggle still. Like I could be in my office right now and have no feeling in my fingers. Wow. My fingers can turn white. And now since I've been 50, they'll turn blue, which I had never had before. But what you were saying, which was, what's that feeling? What was going on in that moment? I can remember exactly what was going on the first time I experienced that type of lack of circulation. And I know what I was feeling at that time in my life, right? Which was very much unheard, unseen, that I didn't matter, that I didn't feel significant. There was some betrayal going on. I had a lot of very complex emotions happening at a very young age.
Right.
In my 40s, after 13 years of suffering and pain, I was finally diagnosed with endometriosis, which was epically painful. Anybody that's ever struggled with endometriosis knows that's another. So I've had these three really intensely painful, I don't know what the word is, conditions. Let's just use that word. Tell me what you think about that. What happened? What's going on in someone's body when you're getting diagnosed with these multiple autoimmune challenges?
Yeah. So a few things. Going back to age 15, right? And was that the Raynaud's that you discovered then? Or yeah. So not a formal diagnosis, but just mentioning something it could be. When we think of feelings of not feeling worthy enough, that sits in a channel in Chinese medicine that we call yin chao. Yin chao has to do with feeling good about ourselves and seeing the beauty in ourselves. A lot of times this will show up also as if you have knees or ankles that buckle in, it's kind of your body going inward. It's your body pulling inward. And that channel runs up through the inside of our legs, which physically is what brings it in. But emotionally, it's this not wanting to feel seen. So being hunched over and turned in. What yin chao does is it causes yin, which is thick substance in our body, to stagnate in our body, right? So it almost hides us from feeling seen, from being seen, by creating this thick substance, which we can call dampness in the body. And dampness is another way of saying mucus congealed in the body. It stagnates your energy. It stagnates the flow of energy. And over time, as this yin stagnates, because yin is a cold energy, it creates cold in the body, right? So if you think about Raynaud's, it's the energy not getting to your fingers. It's that stagnation of energy combined with that feeling of cold, which is very similar to that idea of yin chao mai and not feeling good about yourself, which again, that sits on our DNA, our cellular level of energy, our deepest level of constitutional qi. Now, over time, as we have stagnation and cold in our body is really smart. And our body knows that's not a good place to sit, right? So what it will do is it will activate our yang energy, our yang qi. Yang qi is warming. Yang qi is heat. So it will activate that yang qi to help break up that dampness, to warm that coldness. But as it does this, it creates heat and inflammation because yang qi is heat. So over time, that heat, it also depletes our resources such as yin, yang, blood, and qi, which will break down our channels and our ability to hold things in our joints, which can show up as arthritis and things like that.
Fascinating.
On top of that, there are different Western medicine theories in terms of endometriosis, but one of them does go back to an autoimmune type condition where, so I'm just going to drink a water first. So in Chinese medicine, there is another channel. So I talked about the 8 extraordinary channels that affect our yuan qi, our deepest level of qi, but there is another channel. There's another set of channels called the divergent channels. And the divergent channels communicate between our Wei Qi, which is our most surface layer level of Qi. That's the energy that runs throughout our muscles, our joints, and the soft tissues in our body, including our uterus and our bladder. Wei Qi is related to our immune system. It controls our immune system, our ability to ward off anything that comes at us, right? Whether that be thoughts and beliefs we don't like, that's our initial defense against it, or actual viruses and bacteria that get thrown at us. What happens in the divergent channels is when something is too much for our body to handle, the divergent channels swoop in and they grab that energy and they hold it in our joints, again, to keep it away from our organs, to protect us.
Yeah.
And that energy is constantly communicating with the Wei level to kind of try to release it. Like, are we ready to release it? And that's what autoimmune disease is from a Chinese medicine perspective, is this communication between the Wei level and the Yuan level. So the most surface level of Qi and the deepest level of Qi. And to come back to endometriosis, there are theories that it is an immune condition, that maybe everyone has endometriosis to some standpoint, and we're meant to. That's the theory, that sometimes endometriosis could be a backflow of our menses, which is meant to happen. And that some women have the immune system to be able to handle it and others don't. And the women that don't have the immune system to handle it end up with painful endometriosis.
So interesting. And in my case, it moved outside of my uterus, right? So it, according to my gynecologist, strangled my fallopian tube and killed it and engulfed my ovary. So at one point they had to go and do surgery, remove the ovary, was not expecting to have to remove the fallopian tube, did that. It was on my colon. It was in areas outside, right? And if anybody's ever had endometriosis or suspects that they should have it, it's really important to get it addressed. A, so you're no longer in pain, and B, so you have a better quality of life and you don't hurt other organs, because that can really happen.
Yeah. I believe any symptom that you have is important to be addressed, because typically symptoms don't get better on their own, they get worse.
And I think this is really important that we talk about this aspect too, because in addition to everything we're talking about, guys, utilizing Chinese medicine for healing, physical healing, emotional healing, whatever, listen to your body, because I was complaining about this pain to my original gynecologist. I never got pregnant. I could never get pregnant. And nobody was saying endometriosis to me, and my periods weren't painful then. So it wasn't on my radar. But once my cycles began being painful, I was saying to my doctor, I think I might have endometriosis, because I had done enough research. This is when you have to listen to your gut and you must advocate for yourself, because he performed, not a tech, he performed an ultrasound on me and told me, I don't see any endometriosis, so you don't have any. And I believed him.
Ultrasound is not a way to diagnose endometriosis.
Well, that's correct. But I didn't learn that for 13 years.
Yes. And that's
so I believed my doctor.
Yeah.
I believed my doctor when he told me, I can look for endometriosis on an ultrasound. I don't see it, so you don't have endometriosis. And I bought that because I'm trusting my doctor, but I'm concerned because I'm in DEFCON level pain. I'm taking 1,000 milligrams of naproxen at any given time during my cycle and destroying my stomach lining. When that doctor retired and I went to a new doctor, and she said, how are you? Because I had used her in the past. And I said, everything's fine, except I still have this pain. And she goes, well, it's classic. It sounds like classic endometriosis. And that's when I said, well, I don't have that, because the ultrasound, she's like, you can't diagnose that through an ultrasound. I was like, okay. And I did do the laparoscopy after waiting 5 more years, because I didn't trust that the surgeon that was meeting with me wasn't going to take both of my ovaries. So, I could have advocated for myself in a different way, but I really didn't know what I didn't know.
Right. And you don't. But what I would argue is if you are suffering from so I had painful periods most of my life since my period started, right? Until I found Chinese medicine. And no point did anyone ever mention that maybe something could be wrong internally. It was just like, nope, here's your birth control. Here's your naproxen, like take more. Okay, we'll give you the birth control so that you don't get your period, right? So that's going to make it better. No point did anyone ever mention anything. It wasn't until I found Eastern medicine that I was able to resolve my painful periods. Now, I have no idea if I had endometriosis because I never did the surgery to find out.
Right.
But that's the point. You don't necessarily need to do the surgery to find out, but figure out a way, right? If holistic medicine is your way, do that. If Western medicine is your way, do that. But don't just live with these symptoms.
Yeah. Yep. And the dampness that you were talking about, part of my waiting 5 years to do that surgery was I was seeing a different acupuncturist than the one I'm seeing now. I think I would have had more success seeing the one I'm seeing now, mainly because she's trained in medicine in China. She's Chinese, and her specialty was obstetrics and gynecology. So she really does understand the whole reproductive area. And I think she could have helped me with this. But the original acupuncturist was talking to me about dampness in my ovaries because they could see on the ultrasound I keep growing these cysts, and they were endometrial cysts. And it was just getting bigger and bigger and bigger over the years. But she was very much to what we were talking about earlier, also encouraging me to stay away from certain foods, engage in other foods that could either dry it out or create heat versus the dampness. And she was really quite knowledgeable in all of that. My hope as we're talking about this is if anyone's listening that's been struggling, it is really important to know that you have options. Right. Now, Katherine, you mentioned that you can do remote work. Can you work with anybody, anywhere?
Anyone, anywhere. That's the beautiful thing about remote work.
Yeah. So it's really important if someone's listening and they feel like this speaks to them, I would highly recommend having a consultation with Katherine, learning about what she's doing, because that is such a battle for so many, specifically women listeners. It's such a battle for so many women that are suffering.
Right. And that's that's the main reason it's not the main reason I started getting into Chinese medicine. That's a different story, but it's the main reason I specialize in trauma and women's health. One, because those two things are related, but also because I had my own women's health struggles. Not just the painful periods, because honestly, I just chalk that up to everyone has painful periods. It was in my teens and my 20s when I didn't know better, and I just assumed like it was normal. No one ever told me otherwise. But it wasn't until I was 30 and I wanted to get pregnant that I realized, oh shit, something's wrong and this isn't going to work. So I think I forgot what my point was.
It doesn't matter.
Maybe it doesn't matter. I don't know. But my point is that there is a solution to everything. And if you're not going to solution what you're doing today, do something else, right? One thing that's important to remember is that you cannot heal from a disease in the same state that created that disease. So if you're not willing to make diet changes, lifestyle changes, mindset changes, and work through some emotional trauma, you are likely not going to heal whatever's going on in your body because you're staying in the same state that created that illness in the first place. Mm-hmm. The first step is understanding that changes need to be made. Mm-hmm. And there are certain ways there are ways of healing things such as endometriosis. You can do the surgery and that can be effective, maybe forever, maybe for a short period of time, because for a lot of women, it does grow back, but you're still not healing the root cause, right? So even if you go and do the surgery, which is okay, right? We all need immediate fixes sometimes. Same goes with joint pain. If you have a joint replacement, if that's what works for you in your life right now, that's wonderful, but you still need to heal that underlying root cause and root pathogen that brought it in the first place.
No doubt. And it's interesting. Had I known what I know now, and had I been practicing what I'm practicing now, I probably would have taken a further, deeper, different route with the endometriosis, like I did with the joint pain, right? Because I knew at that time this idea of putting a Band-Aid on a bullet wound was not, because my endometriosis came back. I mean, the pain was just it. And, now I'm in menopause. It's a whole other struggle, but at least I don't have any, I don't have the endometrial pain anymore. Okay. So for those without access, and we kind of just led into this, but I'll let you. So 2 things for people who don't have access to formal Chinese medicine, what can they do to try to support their healing journey from home? Now, I know you mentioned that you can do remote work. So can you talk a little bit about that?
Yeah, so remote work is really exactly the same as my in-person work, except for we're on a screen and I'm not physically touching you. So it starts with a conversation to uncover what is going on in your body, to uncover your history. We'll start to unravel what are the core beliefs behind it, which, some people in their first session will understand the core belief. Other people, it takes 10, right? It just depends where you are in your healing journey. Then we will do the treatment. I tap into your energetic body and check your pulses. I do this through my training in shamanic work, which I've studied with for a long time also. And from there, I will energetically tap into the channel of healing in your body, right? So the way I do that is I first tap into it with my own physical body, and then I send it over to your energy body. Now, I know to a lot of people, this may sound woo-woo, but if you feel it and experience it, I think you understand it a lot better. During the healing process, I incorporate different things and different tools depending on the person and what they're going through, or sometimes I just let people rest. It's the same as my in-person practice. But sometimes we'll do breath work. Sometimes we will do a little inner child work. Sometimes we will do visualizing. It really just depends what's going on in that person and what needs to be unlocked and what needs to be shifted. But it's all meant to support that energetic movement and that part of the treatment. And then I support it with diet and lifestyle to help support the energy of the treatment.
And if they're not ready to start working with a practitioner, what are some simple practices that they can try at home on their own to support their healing journey?
I think the best thing you can do is learn to connect with your body and your intuition, right? So like I mentioned before, just taking some time to sit in silence. It doesn't need to be long. I know a lot of people get caught up on meditation needing to be this thing and needs to be a certain time period, or I'm not good at meditation. Just take a moment to sit quietly, right? Focus on your breathing. Focus on the inhale and the exhale. What that does, it brings you back to the present moment. And then once you do that, just take a moment to feel into your body. What am I feeling today? How do I feel? Does something feel stuck? Does something feel off? Just tapping into how you feel is the first part of healing, because you need to understand where you're at and where you want to be.
And I'm just going to follow this up for those that are listening that are going to fall into what I'm about to say is sometimes I've noticed working with clients who do have a trauma history that can be significant, that they're cognitively aware of, that they're consciously aware of. If they found themselves early on were, fighting and fleeing and fawning, were not going to be successful, they got really skilled at freezing.
Yeah.
And my clients that got really skilled at freezing literally have taught themselves how to disassociate from themselves and from their bodies. So it's sometimes not uncommon for those particular clients, if they're sitting across from me, either on a screen or on my couch, and I'll say, let's connect with your body, they can't. Or if I say, what do you feel in and around your body? They cannot. So we're going even a step deeper than what you're just describing now, and learning. I have a number of tools to help them start to identify certain things that they do within their body that signify certain feelings or emotions, like clenching your jaw or fidgeting in your skin or feeling an itch or whatever it is. So for those of you who are listening that brilliantly engaged in the tactic of freeze to the extent where you learned how to disassociate, kudos to you for finding the most brilliant skill. But at the same time, there's a way to learn how to connect back to your body.
Yeah.
And sometimes that's a precursor even to what you're talking about. Because I don't want people to listen and go, yeah, I can't even do that.
Yeah.
Like I can't even connect with my body.
Totally. And I forget, but I was that freeze person, right? And not even from big trauma. I don't have big trauma in my life. I just have that everyday trauma that everyone grows up with. But I am that classic freeze person. That is my go-to response, is to freeze, put up a shield, and walk away. So to your point, yes, noticing what's going on in your body and just noticing even what you react to, right? A lot of times we get triggered or we react to things and we don't even know what's happening.
Yeah.
Would argue, though, if you are someone that feels like you have deep trauma, it is really important to gain support.
And I'll tell you, I think that you're right, Katherine. Like, if I had to look at, the 150 plus people I've worked with over the last 4 years, the majority of them don't have quote unquote big T trauma. I understand the value of like designating big T trauma and little T trauma for people, but really at the end of the day, the impact is the same on your body.
Right.
It doesn't matter if there was sexual abuse, physical abuse, psychological abuse, aggression, violence, or lack thereof. I have learned in my practice that sometimes silence over violence is even more profound and impactful on the person. Right? So that neglect, that abandonment, that not feeling seen, heard, significant, important without the aggression, the abuse, and acts of violence sometimes are worse and more confusing to the person, because it's just been this mist of dysfunction, which is their myth of normal. And they don't know that what they experienced, it might have been normal for their culture, their community, their family, their households, what have you, but it might not be normal for in your case, the chi, in my case, the nervous system. Your human body may not be designed for whatever's normal within whatever it is that you experienced. And so this is why you're feeling this reaction.
The majority of people I work with, it's when I ask about their childhood, it's like, oh, I had this great childhood. I had everything I needed. I was fine. My parents loved me. But then when we dig deeper, there's always something there. And it can be really confusing for those patients, because it's like, wait, but my childhood was perfect. And yes, you can have a lovely childhood and still go through things. And from my perspective and from a Chinese medicine perspective, we are meant to go through things. So yes, you had a perfect childhood, and yes, you went through the things you're meant to go through.
Yeah, I love it. And it's a perfect place to end this. This has been a great conversation. I could literally spend hours talking about this, mainly because Chinese medicine has helped me in so many ways. And it is something that I practice and engage in, not every single day, but I actively make the time to connect with my Chinese medicine practitioner twice a month, easily, like pretty much every other week. So if you're listening and you're feeling stuck in your mind, body, and psyche, and you've never considered Chinese medicine, this is my soapbox to say consider it. I've never worked with Katherine directly, but I have a practitioner I love, and I think it's a wonderful, wonderful modality. So for people that are interested, Katherine can be found at Manhattan Medicine Woman. Her office is in downtown Manhattan, but she also does remote work. If there's anything else, is there anything else you want to part as we leave today? Is there anything you want people to know?
The one thing I want everyone in the world to know is whatever you're going through mentally, physically, or emotionally, it is reversible. And I think so many times we're told it's not, that we're told there's no hope, there's no way, there's no cure, but there is. It just might not be that you found it yet, but everything is reversible.
I love it. It's a great way to end it. So thank you so much for being on the podcast today. And again, guys, it's Manhattan Medicine Woman. Katherine, thank you so much for sharing your insights on the brain-body connection in trauma healing through Chinese medicine. Your expertise provides hope and practical steps for those on their own healing journey. If you're interested and want to learn more about Katherine's work, visit the Manhattan Medicine Woman. If you found today's episode helpful, please subscribe. Also, leave a review or share it with somebody who could benefit. Remember, healing is possible and every step forward counts.